and welcome to Nursing Student Preceptorship, presented by Concordia University Irvine Nursing Program. My name is Mary Bowman, and I will be your presenter. I am excited to join you on this journey to learn about the roles and responsibilities as a preceptor for nursing students. I have a master's degree in nursing education from Walden University and have been a bedside nurse, educator, and nurse leader in a variety of healthcare settings for over 30 years. In ambulatory care, I have worked in a family practice and obstetrical gynecologic medical offices as an LVN and RN. In acute setting, I have cared for labor and delivery, postpartum, high-risk antepartum, and newborn patients. Additionally, I have worked as a nurse educator and operations manager for Women's and Children's Services. Currently, I am an assistant professor in the Concordia University Irvine Nursing Program. I teach maternal infant health, leadership, and senior preceptorship for the Accelerated Bachelor's of Science in the Nursing Program. On behalf of the Concordia University Irvine Nursing Program, I would like to express our appreciation for your participation as a preceptor for our senior nursing students. We appreciate your willingness to share your knowledge, clinical experience, and patience with our students as they transition into the role of the professional nurse. The purpose of this presentation is to prepare the nurse for their role as a preceptor, providing tools to empower student nurses to become competent and safe members of the healthcare team. So first, let's talk about the objectives. At the conclusion of this presentation, the learner will be able to identify and define the preceptorship triad roles and responsibilities, identify and discuss the three primary roles of a preceptor, also develop a plan to facilitate learning that includes goals, CUI competencies, experiences, and evaluation. Describe and understand the use of different theories of learning. Identify and discuss methods to promote critical decision-making skills. Discuss effective communication strategies in providing constructive feedback. To discuss effective conflict resolution strategies to help a struggling student. And understand the process to build a positive learning experience. Concordia University Irvine is a private Lutheran university. The CUI nursing program is an accelerated Bachelor of Science in Nursing called the ABSN program. Students complete all required BRN pre-licensure hours for classroom, lab, and clinical time in 3 semesters. The CUI nursing philosophy statement is as follows. Nursing is a profession that encompasses professional and personal values, core knowledge, and competencies in developing a multiplicity of roles such as healthcare provider, educator, patient advocate, and leader. It is also a service to humanity. Essential to this discipline is the refinement of attributes that encourage the holistic development of the self in order to become socially responsive to the healthcare needs of a cultural, diverse world. The CUI Nursing Pre-Licensure Program is an accelerated Bachelor of Science in Nursing ABSN program. The program is accredited by the Western Association of Schools and Colleges, called WASC, and the Commission on Collegiate Nursing Education, called CCNE. It is also approved, evaluated, and monitored by the California Board of Registered Nursing, called the BRN. Because it is a pre-licensure program, preparing graduates to take the NCLEX RN exam, students must complete the classroom coursework and clinical hours as required by all pre-licensure programs in California. The CUI nursing program's philosophy, objectives, and goals are congruent with the Nurse Practice Act of California. Dr. Jean Watson's philosophy of caring and nursing, the mission and goals of CUI, and the standards identified by the CCNE. The Department of Nursing at CUI educates nursing students to become competent, compassionate, and holistic nursing professionals who uphold Christian values in their service to individuals, families, and communities. During their coursework, students learn and practice skills, including psychomotor, professional, and therapeutic interpersonal skills, organizational skills, interdisciplinary skills, critical thinking, emotional intelligence, teamwork, and collaboration. The Simulation Learning Lab is available for students prior and during their preceptorship clinical hours to refine their skills as appropriate. Preceptorship consists of a triad: the preceptor, the student, and the faculty instructor, all of whom play vital roles in the success of the preceptorship experience. The following slides are a summary of the various roles and responsibilities essential to each of the members of the triad. A preceptor for nursing students is a registered nurse who has specialized in an area of nursing. He or she is also willing and prepared to act as a clinical supervisor and teacher who can guide the student through experiential events that build clinical and leadership skills. Additionally, a preceptor acts as a role model to help orient and integrate the student into the nursing profession. Nurse preceptors are a significant link in developing and inspiring the next generation in professional nursing. Nurses who precept a Concordia University Irvine nursing student will be providing an insider's view into what it really means to be a professional nurse. As a preceptor, you will have the opportunity to assist nursing students to develop and refine nursing skills, to apply theory to practice, and to develop essential professional nurse role behaviors. As a preceptor, you will have the opportunity to help the student nurse develop the skills to incorporate the nursing process, perform simple to complex nursing care skills, teach clients and families about self-care, disease management and prevention, and health promotion, learn and implement the ability to appropriately delegate and supervise members of the healthcare team. In addition, you will aid the student nurse to develop the ability to evaluate patients' responses to nursing and medical care, as well as present a plan of care in concert with the patient while advocating for best treatment and nursing care options with members of the healthcare team in a variety of settings. The preceptor monitors and assists senior nursing students to care for patients and families in specific clinical settings, to build clinical skills with patients in a clinical setting, and enhance leadership skills through experiences introduced by the preceptor, to develop a realistic vision and understanding of the professional role, and maintain effective communications with the instructor and student. Additionally, preceptors assist in evaluating the student and direct students toward activities to successfully achieve course objectives. A preceptor also directly communicates any concerns to the CUI faculty in a timely manner. The student nurse participates in a preceptorship program designed to orient him or her to develop such skills as clinical assessments of patients, leadership, application of evidence-based practice, critical thinking skills, and patient teaching. For the student nurse, the goal is to have a successful clinical learning experience and to transition into the nursing profession. The student will complete clinical hours in an acute or ambulatory setting. On the first day of clinical, the student will review the preceptor packet with the assigned preceptor. The student works under the supervision of the preceptor or designee and collaborates appropriately with other members of the healthcare team. They will submit a planned schedule to their clinical faculty prior to completing the second clinical day, and any change to the schedule must be approved by faculty 48 hours prior to implementation unless the healthcare setting changes something at the beginning of the shift. The student works with the preceptor to identify learning needs and to seek out opportunities to meet the majority of clinical objectives as experiences are available. The student is accountable in providing safe, competent care and maintains compliance with agency requirements. The student is also obligated to contact their preceptor and clinical faculty in advance for any absences and directly communicates to CUI nursing faculty of any errors in patient care, medication administration, or invasive procedures. The student is involved in self-directed learning and responds appropriately to feedback from the preceptor and faculty of record. The student follows medication and invasive procedure policies and code of professional conduct as stated in the Student Nursing Handbook. The faculty of record for the remainder of this presentation will be referred to as the instructor. The instructor supports a positive relationship between student, preceptor, and faculty member. The instructor sets up a conference schedule for faculty, preceptor, and student during the semester and maintains effective and ongoing communications with the preceptor. The instructor collaborates with the student and preceptor to ensure student success as they transition into entry-level nursing practice. The instructor maintains ultimate responsibility for final evaluation of each student and remains on call while students are in the clinical setting. Additionally, the instructor tracks all student activities during the course of the semester. The main three roles of the nurse preceptor are as follows. Role modeling, which is a process in which an individual identifies with and assumes the values and behaviors of another person that ultimately results in behavior modification that is usually permanent. Facilitator of the socialization or integration of the student with the unit's culture and develop social interaction with other healthcare members. The third primary role is as an educator to the student. The preceptor's responsibility for teaching and promoting critical thinking, problem solving, and providing constructive feedback and encouragement. Preceptors challenge, guide, and direct students while serving as a role model. A preceptor demonstrates clear boundaries and expectations and role model evidence-based professional nursing practice. They serve as a resource, demonstrating time management and organizational skills, promoting effective communication, collaborating with healthcare team, and demonstrating safe, competent, and confident patient care. As a role model, a preceptor demonstrates lifelong learning and shows the student where and how to use available resources. As a facilitator, one of the most crucial steps in the preceptor-student relationship is to establish trust, to provide a foundation to promote a positive learning experience. One way to accomplish a positive relationship is for the preceptor to share their own experiences as a new nurse and review the student's background, career goals, and learning objectives. Does the student have prior experience as a nurse's aide, EMT, medical assistant, or any other healthcare experience? Some of the questions that a preceptor can ask to find out how the student feels and what do they want to accomplish during their preceptorship experience are as follows. What concerns do they have about their role as a student nurse in a preceptorship? How can I best help you as a preceptor through this experience? These questions will help the student feel more comfortable in their surroundings. When trust is fostered between the preceptor and the nursing student, the student nurse understands their role and limitations. The next step is to orient the student nurse to the values, culture, and mission of the organization and the unit climate. It is important to introduce and clarify the different roles of the healthcare team. For instance, the charge nurse, the medical assistant, nurse practitioner, physician assistant, and additionally orient the student nurse to the clinical setting equipment in the patient's rooms, supplies, crash cart, and policies and procedures. The main role of the facilitator is to promote socialization and integration into the nursing profession and create a culture of respect. As an educator, a preceptor creates a safe learning environment. He or she provides information, facts, and rationale of care to help the student connect the dots between theory and clinical practice. During your first shift, ask the student the following questions to assess their learning needs. What are your strengths and what are your weaknesses? What are some nursing skills that you wish to develop during this orientation period? What are your biggest concerns or fears? It is important to understand that we remember 10% of what we read, 20% of what we hear, 30% of what we see, 50% of what we see and hear, 70% of what we discuss with others, 80% of what we personally experience, and 95% of what we teach others. Therefore, it is important to ask and answer questions, review theory, procedural steps, and demonstrate clinical skills. Oversee return demonstrations and provide emotional support and coaching. Give constructive feedback and continue to help the student meet their learning objectives. The most important thing about learning objectives and goals is having them. The purpose of setting goals is to improve the preceptorship experience. Goals define a learning plan which clarifies expectations, identify learning opportunities, and establish a basis for feedback and evaluation. The nursing student will have learning objectives to meet for the duration of their preceptorship and goals for each clinical day. For example, one objective for the preceptorship is to learn and establish time management skills by shift 6. And for the daily goal could be to locate and review policy and procedures. The benefit of having objectives and goals is to have a target to lessen anxieties. They provide a structure and direction and help discover areas of strength and weakness. It allows the student to be accountable and promotes feelings of success and satisfaction. And because they are measured, it promotes prioritization. The learning objectives are written in SMART language. S is for specific, M is for measurable, A is for achievable, R for realistic, and T is for timed. An example of a SMART objective is the following. The student nurse will be able to safely administer medications under the provision of the preceptor RN by the third shift. The student nurse will locate the supply rooms, become oriented to the crash carts and med rooms by the end of the first shift. The nursing student will bring the learning objective on the first day of clinical to share and get insight from the preceptor. The preceptor will discuss the objectives with the student and make additional suggestions. The objectives will also have guidance from the instructor. The preceptor and student will evaluate the objectives during the course of the preceptorship to assure that the objectives can be met. As a preceptor and educator, it is important to ensure that the student nurse will deliver quality, safe, patient-centered care with a foundation in evidence-based practice. In 2007, the Robert Wood Johnson Foundation supported a program called Quality and Safety Education for Nurses. The purpose is to address the challenge of preparing nurses with the competencies necessary to continuously improve the quality of safety of the healthcare systems in which they work. The CUI competencies are embedded into the nursing education curriculum, and therefore the student nurse is aware of the importance in delivering safe patient care based on best practices. The reflection journals for preceptorship is also based on the following CUI competencies. Patient-centered care. Recognize the patient or designee as the source of control and full partner in providing compassionate and coordinating care based on respect for patients' preferences, values, and needs. Teamwork and collaboration. Function effectively within nursing and interprofessional teams, fostering open communication, mutual respect, and shared decision-making to achieve quality patient care. Evidence-based practice. Integrate best current evidence with clinical expertise and patient family preferences and values for delivery optimal health care. Quality improvement. Use data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. Safety minimizes risk of harm to patients and providers through both system effectiveness and individual performance. Informatics. Use information and technology to communicate, manage knowledge, mitigate error, and support decision-making. Adult learning theories provide the best possible learning experiences. To help guide the preceptor in the role of the educator, it is imperative that we discuss theories of learning. Nurses have learned that theory informs our practice. There is continued emphasis on evidence-based practice when providing nursing care to patients. This is also significant in the preceptor role, where it is important to understand adult learning theories in order to provide the best possible learning experiences. Understandably, there is some difficulty in using the more common learning theories in the organizational settings in which clinical experience is obtained. Theories seem to be more easily applied in the classroom setting where accountability for patient welfare is not the primary consideration. However, there is a belief among educators that learning styles exist and play a significant role in how students learn, which ultimately leads to how they will apply that learning in providing patient care. Although it is often suggested we adapt our teaching style to the learner's needs, there's also the belief that the adult student should have awareness of their own learning style preferences in order to find ways to optimize their own learning. There are a wide variety of learning theories found in many disciplines, and many seem similar or overlap each other in content and styles. The most commonly used theories in nursing are those that are considered information processing theories. One of the most widely known learning styles theories, experiential learning theory, was developed by David Kolb, who described learning as occurring as a process of transformation through experience. Kolb defines learners as divergers, assimilators, accommodators, and convergers who learn either through knowledge apprehension or comprehension and who transform knowledge either through reflected observation or active experimentation. Transformation happens through either extension or intention. Extension is a process achieved by active external experimentation. Intention is achieved through internal reflection of the experience. Accommodators learn by apprehension and benefit from hands-on experience, while divergers learn by apprehension as well, yet internalize by reflection. The convergers learn by comprehension, separating theory from actual experience. And lastly, assimilators learn by comprehension, yet internalize the learning. All platforms of the cycle must be experienced for learning to be transformed. Therefore, experiencing concrete clinical situations, reflecting on the experiences, concluding and learning from the experiences, and practicing what you have learned leads to positive and safe clinical experiences. Dreyfus and Dreyfus define very well the issues surrounding the difficulties in developing a nursing student into a safe, competent, and proficient licensed practicing nurse when they explain that the theory of nursing includes scientific knowledge learned in the classroom as well as rules of thumb that are learned through hands-on experiences in the clinical setting. The typical rules of thumb are of the form: if you observe the following phenomenon, then you should take the following action. These include those practices that are based on experiences and developed by nurses over time that can't be explained in scientific terms, but that provide for best nursing practice. Ideally, theory and practice intertwined as the nursing student develops over time. It is important to consider that first and foremost, nursing is a caring practice. This means nursing practice often reaches beyond theory, where human meaning resides, a place where one needs a kind of intuition that can never be captured by rational theory. To develop a theory of skill acquisition, Dreyfus and Dreyfus studied the learning process of various professionals. They discovered that typically a person will pass through 5 stages of different perceptions of their task as skills improve. Patricia Benner used the original Dreyfus model of skill acquisition and described nurses going through 5 levels of development, where each level is reached by building upon experience and education. Benner's theory, from novice to expert, has been instrumental in developing clinical, facility-based education programs, as well as curriculum in the academic setting. Since Benner's theory has been proven to be relevant in a wide variety of settings, it can be considered here as a way to direct the learning of nursing students, as well as evaluate their progress. It should be noted here that California BRN has determined the obligation of California nursing programs is to assure nursing students graduate at the advanced beginner level. Benner describes 5 levels of nursing experience as novice, advanced beginner, competent, proficient, and expert. Each level builds on the previous one, as understanding of theory is refined through experience and practice. Level 1 novice generally begins with no experience and is taught general rules to perform tasks that can be applied universally. At this stage, behaviors tend to be rule-governed, limited, and inflexible. Level 2, advanced beginner, can demonstrate marginally acceptable behavior. They have usually experienced enough real situations to begin to discern meaningful components. At this stage, principles to guide actions are being formulated. However, all components of care are seen as equally important. The advanced beginner is not yet able to determine what is most important and therefore needs support in the clinical setting. Level 3, competent, typically requires 2 to 3 years on-the-job experience, has learned to achieve greater efficiency in organization through conscious and analytical thinking. At this stage, experiences provide the ability to cope with and manage the many contingencies of clinical nursing, to work well within protocols and standards. But the learner may need support in seeing the overall picture and determining priorities. Level 4, proficient, has learned from experience what to expect in certain situations and has a more holistic understanding of situations, which improves decision-making and allows for modification of plans as needed. At this stage, the practitioner easily recognizes and acts on priorities in a variety of situations. Level 5 is the expert, has an intuitive grasp of clinical situations based on an increased background of experiences, so that performance is flexible and highly proficient. At this stage, the practitioner has a highly skilled analytical ability and deep understanding of the whole picture. As the practitioner passes through these 5 levels, changes in performance can be observed from a reliance on principles and rules in a concrete, specific setting to an ability to see the whole picture and establish priorities. The final outcome is seen as moving from detached observation to being engaged and involved directly in the situation. In other words, theory guides clinicians, enabling them to ask the right questions and direct clinical practice in a multitude of circumstances. It is not expected the RN preceptor will adapt teaching styles to the student, but rather use the knowledge gained to understand how the student learns to guide him or herself to a successful adaptation to the clinical setting. Rubenfeld challenges nurses to change our thinking, to understand that nursing education cannot rely on the traditional dispensing of information to learners. In providing the optimal learning experiences, academic faculty and clinical personnel should recognize the need for a collaborative effort and encourage students to be active knowledge seekers rather than passive information receivers. adding to the complexity of learning styles and developing the optimal learning environment is the concept of generational differences. Currently, our nursing workforce is composed of nurses from 4 different generational cohorts, from the newest who are graduating from diverse nursing programs to those who are preparing for retirement. Today's workforce is also different from past generations in that employer and managers may be younger than their employees and those they supervise. Managers may be recent graduates with little practical experience, supervising employees with years of practice in the workplace. Although the concept of multiple generations of people with different experiences, work habits, beliefs, and attitudes may seem discouraging, it is believed that diversity can add richness and strength to the team if all staff members are valued for their contributions. So what is critical thinking? Critical thinking requires the following: a person to have knowledge about the subject, interpretation or analysis of an issue, followed by evaluation or judgment. It is learned by answering challenging, open-ended questions that require genuine inquiry, analysis, or assessment. It is not a natural skill, and it takes time and effort to learn. The topic of critical thinking is essential in nursing practice and not an easy task to learn, as it is not a natural skill and takes time and effort to learn. A person needs to have knowledge about the subject and learns by analysis, open-ended questions, and assessment. Additionally, the student needs to learn how to interpret, analyze an issue, and follow with evaluation or judgment. In order to think critically, the student nurse should be able to recognize patient care problems, identify alternative nursing interventions to provide care, and anticipate the outcome of the care provided. The preceptor can aid the student in critical thinking skills by asking questions about nursing diagnosis, disease management, medication. For example, ask what the medication does and why the patient is taking it. What are the side effects? How would you educate the patient? According to Chaco, to think critically, nurses must be capable of 3 actions: thinking ahead, thinking in action, and thinking back. Thinking ahead, nursing students must be proactive and have the ability to plan ahead for any patient conflict or issue. The preceptor can ask the following questions to encourage thinking ahead. What complications could occur in this patient? What issues will you have to manage? What supplies or resources will you need to care for the patient? Students must be able to think while caring for the patient and in the midst of stress. Review with the student why a procedure is needed and the potential problems that might occur. Students must be able to think back to actions taken, reason, and analyze why actions were taken. The students should ask themselves whether anything could have been done differently. The preceptor can ask the following questions to emphasize this point. What was the most important patient issue to consider? Was the most important issue addressed? Of the facts that you have gathered, which was the most important and why? The student nurse understands the importance of the nursing process and are used to being asked critical thinking questions regarding patients. The preceptor can enhance this experience by asking thought-provoking questions under each category of the nursing process. For example, assessment. After assessing your patient, what other information do you feel that you need? What do you think is contributing to the lab or test result? Planning. What are the next steps you are going to perform for this patient? Establish a priority list for the care of this patient. What should be done immediately? What should be done next? Implementation. What are your plans for meeting the goals you have established for this patient? Why is this medication, treatment, lab work needed? How can you act as the patient advocate in this situation? And evaluation. What evidence can you provide to demonstrate that your plan of care was effective? How do you know the actions you have taken have been effective? Address nursing actions within the nursing process, including critical thinking. Feedback is the process where information about performance is shared with the student, and it provides evaluative and corrective information that helps regulate the performance. It is expressed as positive, negative, or constructive. Positive feedback inspires the learner and reinforces positive behavior. By being specific rather than general, it is important to be factual and descriptive with your feedback rather than judgmental. Positive feedback enhances feelings of success, motivation, self-esteem, confidence, and reinforces desired performance. Negative feedback inhibits or modifies existing behaviors and is intended to stop or discontinue. The obstacles of negative feedback produce feelings of failure, limits or reduces motivation, and diminishes self-esteem and confidence. Negative feedback makes the preceptor and the student feel uncomfortable. Constructive feedback is intended to modify, correct, or improve student performance and is conveyed with supportive language. Constructive feedback focuses on directing toward the student's problem behaviors instead of them personally. It avoids blaming or shaming. To achieve effective feedback, the preceptor can describe to the student what was observed, who, what, when, where, how, and be specific about the situation. Relate how the behavior affected the situation and describe the effects. Most importantly, suggest an alternative behavior when indicated. According to Chaco, some leaders use the feedback sandwich method to provide feedback to the subordinates. It is designed to sandwich the negative feedback with positive to soften the harshness of performance improvement issues. This method hinders trust. Positive feedback seems to be forgotten as the feedback focuses on the negative. According to Chaco, this method is not straightforward, and the importance of the behavior or action to be improved is lost. It is better overall to be direct and to offer guidance and coaching to improve the behavior or action. A better method to communicate the need for performance improvement or provide constructive criticism is the BEER method. B is for behavior. Communicate to the preceptee a specific undesirable behavior that has been directly observed. Use clear and concise language about what you find unacceptable. Provide date and times. Do not generalize. Focus on behavior only, not personality. Example, I'm disappointed that you did not follow the correct steps to ensure proper technique when suctioning patient. I am disappointed that you did not follow the correct steps to ensure safe and proper technique when giving an injection. E is for effect. Explain why the behavior is not acceptable. Explain how the unwanted behavior or action could potentially impact patient care and safety. Ensure they understand what you are telling them. Clarify and confirm. For example, are you aware that if you do not follow the proper procedure when suctioning a patient, the patient could develop an upper respiratory infection? Are you aware that if you do not follow the proper safety mechanisms for giving injections, that you could give the wrong medication to the patient? E is for expectation. Verbalize expectations. Involve them if needing to develop a course of action to change behavior. Ensure that both of you agree on the course of action. The end goal is to promote competence. R is for results. Explain how the changed behavior will positively impact patient care and safety. Also explain the implications if the behavior does not change. Emphasize the main objectives of what the preceptee could do differently. Express confidence in the student's ability to improve and offer your continued support. Notify the instructor so he or she can assist with solutions to the behavior or action of concern. Remember to focus on the behavior. Chaco uses the following example. If the student nurse continually leaves the unit without notifying the preceptor, a personality-based feedback may focus on how this is inconsiderate. The behavior-based feedback focuses on how this is unsafe for the patients. This method focuses your comments on situations and behaviors and outlines the impact it may cause on others. Another example is the student is late and unable to hear report on the patient. You might say the following. I noticed that you have been late the last 2 shifts. When you are late, you miss hearing report about our assigned patients. What can you do to ensure that you are on time to practice receiving report? This method provides the student an opportunity to explain the reason for their tardiness and create a plan to be on time. One important aspect of precepting is assisting the student that may struggle during their preceptorship. If you notice an attitude or performance issue, you may discuss with the student first and then notify the instructor, or directly notify the instructor and discuss your concerns. If you feel comfortable to discuss with the student first, here are a few tips. It is important to be objective and place the problem in context. Was it a misunderstanding or communication issue or just a bad day? After addressing the student, the following issues are definite concerns to alert the faculty of record as soon as you see it. Leaving the unit without permission or without telling staff. Being uneasy with clinical skills, making frequent mistakes. Failing to review skills prior to performing them. Being easily distracted and not interested in the surroundings or learning. Displaying unprofessional behavior. To address unsatisfactory behavior or clinical performance, I developed the following acronym, LAPS. L is for active listening to both the preceptor and student about the behavior or performance to help guide the process and addressing the problem. Depending on the situation, the instructor will meet with the preceptor and student together or each one of them privately. The instructor will ask questions, elicit suggestions, and document the conversations. A is for acknowledge assessment of the situation. The instructor, and if warranted, the course coordinator and administration will meet with the student to gain insight into the situation and have a problem-solution-based discussion. The conversation is directed to identify the underlying needs of the student to meet the preceptorship learning outcomes. The goal is to acknowledge, assess, and address the issue to move towards a plan for success. P is to create a learning plan to establish goals, objectives, strategies, and resources for observation and practice. Does the student need more lab time to practice skills or practice case scenarios to improve critical thinking skills? Or does the student need techniques on conflict resolution strategies? S is to determine success by evaluation of improvement and progress. It is important to provide constructive feedback during each clinical day. The instructor will visit the preceptor and student either the first or second day of the student's clinical to review objectives and answer any questions. Remember that the instructor is available to you via email, text, or phone. It is imperative that the student adheres to the learning plan and is recognized by the preceptor and instructor for their successes and clearly identify where improvements still need to occur. At midpoint of the clinical rotation, the instructor will email the preceptor a list of questions regarding students' professionalism and performance. Since this is a student that is struggling, the instructor may need to make another visit prior to sending out the questions. If the student is not progressing, the instructor will notify their nursing administration, and a course of action will be initiated. A successful learning experience can be fostered by encouraging questions, keep performance expectations realistic, provide praise, encouragement, and support. Reassure the patient and family that before performing any skill, the student nurse will receive instruction, practice, and supervision. Provide comfortable, relaxed, non-judgmental atmosphere with a variety of learning opportunities. Other aspects of promoting success are the following. Notice and acknowledge the positive actions of the student and say thank you. Actively seek out situations involving the student that are going well. Convey appreciation and why. Include how the student can change or evolve and progress. Be specific with your teaching. Here are a few questions that preceptors typically have. Is the student working under my RN license? The student does not work under your license. When engaged in clinical learning experiences, the nursing student is under the supervision of the RN in the facility. Direct supervision of students means a clinical preceptor is physically present at the practice site. The clinical preceptor retains the responsibility for patient care while overseeing the student. What skills is the student competent to perform? Clarity about the student's level of competence will serve as a basis for appropriate patient assignments and adequate supervision. Therefore, the student will provide a brief summary of their clinical experiences before and during nursing school. Faculty is available to the preceptor and student during the entire time the student is involved in the preceptorship learning activity. Can students be counted as licensed personnel? Students cannot be counted as a licensed personnel when checking insulin, heparin, blood products, or any medications requiring 2 licensed personnel. How and when do I communicate with the faculty instructor? Faculty instructors are on call when the student are in their clinical site for preceptorship. The instructor will provide their phone number to contact them at any time you might need them. Please notify the instructor immediately if you observe the student demonstrate unsafe or unprofessional conduct. The information shared with faculty is held in strict confidence. How does CUI address unsatisfactory behavior or clinical performance? Concordia University has a process to help the student that is struggling. The instructor will collaborate with the nursing program's director of nursing and with the hospital liaison to determine the next course of action. The nursing program will follow the process discussed in the presentation called LAPS. What do I do if the student makes a mistake or has a near miss? It is also important to notify the instructor if the student makes an error or a near miss. The student will work with the preceptor to correct the error and complete the necessary hospital documentation. What happens if the student is injured while precepting? The nursing program also has a policy if the student gets injured, and the student is advised to contact their instructor. The instructor will provide further instructions to the student to complete an incident report for the nursing program. What is FERPA? The preceptor and instructor must uphold the requirements of the Family Educational Rights and Privacy Act, which requires the student's academic records must be kept confidential. This means that the student's clinical performance must not be discussed with anyone except the supervising faculty member. What do I do if I am ill or I have a change in my schedule? Notify the student as soon as possible. The student notifies the faculty instructor. There are a few things that can be arranged. Reschedule the clinical time with the student, or the charge RN or nurse manager can reassign the student to another qualified RN, an alternate preceptor for the scheduled time. If you are floated to a different unit and it is approved by the charge RN or nurse manager, the student can float with the preceptor. Otherwise, the student can stay on the assigned unit with a qualified alternate preceptor assigned by the charge RN or nurse manager. Collaboration between the preceptor, the faculty, and the student is formally established at the beginning of the experience. It is important that each individual obtain a clear and mutual understanding of the purpose of the arrangement and the related responsibilities of each role. Lines of communication must be established with open communication throughout the experience. The preceptorship experience allows the student opportunities to become familiar with staffing and client assignment activities in the healthcare agency assigned, implement the nursing process and critical thinking in caring for individuals and/or groups of clients in a clinical setting. Additionally, the experience provides opportunities to implement leadership and management skills and to develop prioritization and organizational skills. Preceptors play an integral role in nursing education and are essential in the clinical training for student nurses. Your knowledge and commitment as a preceptor is tremendously valuable to the Concordia University nursing program. And we wanted to take this opportunity to thank you for modeling lifelong learning and professional growth for our students and providing a safe, positive learning environment. We hope you agree that precepting offers many rewards, including watching and participating in the transformation of a novice student into an advanced beginner nurse and introduction into the nursing profession.